Friend Nurse Abena, a registered psychiatric nurse in Ireland. In today's video, I want us to look at some challenges that overseas nursing comes with. If today is the first time coming across my channel, you are so much welcome. Please do subscribe, like, comment, and share. There are so many videos on this channel about overseas nursing, migration process as a registered nurse coming into Ireland, what you need to go through, what the process entails, and many more videos that will help you in your relocation to the Republic of Ireland as far as you are a healthcare worker. If you are interested in knowing more about this, then you always have to stick to this channel. Are you ready for today's session? Please stick and stay with me. Keep subscribing, like, comment, and share. Let's get started. To my channel, guys, no time to waste. What are some of the challenges that overseas nursing comes with? Trust me, some of these challenges many overseas nurses are going through it. Many has had their share of experience, and with this kind of challenges, trust me, it can cause your contract to be terminated, and secondly, it can actually cause you to lose your PIN. Remember, this international nursing PIN that you went through a lot of process, struggle to get it, it should be your priority to do everything possible to protect your international nursing PIN. And some of these challenges can come your way to affect your PIN and your contract. So this video is actually going to help a lot of us who are already in Ireland or already in any other part of the country practicing of the world, practicing as nurses, and it will also highly benefit those nurses who are yet to migrate. This will actually prepare you physically, mentally, and socially so that you'll be able to walk out positively when you are confronted with some of these challenges. You need to prepare yourself well before you get into the country and begin practicing as a registered nurse wherever country that you are going in. The challenges are real and it should be your priority to protect. First challenge I will talk about is long hours of shifts. Long hours of shifts can sometimes be very difficult from the beginning of your work as an international nurse, because most of us comes from places where we are used to short hours of shifts, because many countries run 3 hours, 3 periods shifts, so morning, afternoon, night, which are short hours. But international nursing, it's not like that. Many places runs the 2 parts shift, day and night, and both are strictly 12 hours. Within the 12 hours, you have intermittent breaks for a total of 1 hour. The beginning of your work as an international nurse, this 12-hour shift can be crazy, especially if you find yourself on a more demanding ward. It won't be easy. So please fasten your seat belts before you get into the country to start working as a registered nurse. For the first 2 years of your contract, you need to stick to this roster. Until after the contract, then you can actually choose your shift. You can then choose how many hours you want to do. But for the first contract that you are coming with, my dear, you need to go by the contract. So it can be very difficult sometimes. Get the right shoes, right clothes to make you comfortable. Thing to know, so you prepare yourself for, is that in overseas nursing, the tax can be demanding. The workload is quite demanding. Here it's not like other places, especially where we're coming from, that you can actually get patients' relatives to assist the patients, do some petty things for the patients, maybe assisting the patients to bath, assisting the patients to go to the bathroom. It is not like that in overseas nursing. The relatives can visit at any time, but hey, you cannot tell a patient's relative to assist the patient to do something whilst you are there. No, you are going to put your PIN under investigation. So the workload is quite demanding. You are literally doing everything for the patient. So make use of your team members. Where you need to get your team members involved, please get them on board. Put your hands together and do it. Don't don't try to impress that you can do it. No, it's very challenging. So always get your team members involved. Communicate well and collaborate well with your team members, and your shifts will always be smooth. And do not forget this: if you are asked to do anything and where you are working, they have not trained you to be doing that, even though back home you were doing those things, please, you need to boldly come out and say that I have not been trained. Don't try to impress with any task, please. If you haven't been trained on, don't be in a rush to do it. Always know your position. Matter of fact, without your nursing pin, you cannot practice as a nurse anywhere. Therefore, anything that you need to do to keep your pin out of trouble should be your priority as an international nurse, because systems are working, policies and protocols are working, and if you take anything for granted, your pin is going to be in hot soup. So another thing that you need to keep yourself up with is the code of practice of the nursing board of the country where you are working. So if you are in Ireland, you need to keep yourself updated with the code of practice of the Nursing and Midwifery Board of Ireland. If you are in UK, you need to update yourself with the code of practice with the UK Nursing and Midwifery Council. Wherever you find yourself as an international nurse, be updating yourself with their nursing board code of practice so that you work according to the code, so that you do not do anything outside the code of practice that will put your pin into a situation that will be very difficult to protect it. You need the pin to work as an international nurse. So in a case where patient is refusing to engage in any tasks that you need to do for the patient, what does the policy say? What do you do where patient is refusing medication, where there is a situation where you, the nurse, needs to withhold a patient's medication? What does the code of practice say? What is the procedure? You need to keep yourself updated with all these things so that you don't do anything outside the code of practice to cause your pain. Another challenging thing with overseas nursing is that patient rights are very firm here. Every patient has rights. You know it already, where we are coming from. We know all this, but you understand. But when it comes to international nursing, every patient's right needs to be respected, and therefore you cannot impose things on patients. So be very mindful of that. It can be very difficult sometimes trying to get the patient to get a task completed and it's not pulling. It can be very stressful, but you need to remember that the patient has rights. So in this situation, avoid situations where the patient can report you. This is something great that you need to do anything possible to avoid. Never give room to a patient to report you, to make complaints about you. The moment a patient starts collecting complaints form to fill against you, hey, my brothers and my fellow nurses coming in to join the international nursing community, please be patient. Whenever you're on shift, be very patient. Be patient with your patients. This is very rhyming. You need to be very patient. Remember that every patient has rights, and their rights are well respected. So you need to also respect that as well. Don't impose things. Don't create room for patients to report you. It's going to put your pain into a situation that will be very uncomfortable for you. This can be challenging, but you can overcome it. Another thing that can be very challenging has to do with reporting time. In your contract, it's been stated when your shift begins, but don't forget that international nursing, there is an intensive handing over meeting before the beginning of the shift, and you dare go in late for handing over. Hey, don't cause trouble for yourself, and don't cause trouble for your pin. Please be punctual. Be very, very punctual. When you need to report early in order to register your presence on time for handing over, please do anything possible to be there. Therefore, you need to make time management a priority. Know what time to get to work, what time to be at handing over. Schedule your time well. Time to benefit yourself and time to benefit the service or the work. You need to have good time for yourself as well. So you need to manage your time very well always. This behavior can actually cause you to lose your contract. The use of phone during shift hours. As an international nurse, hey, please, you need to position yourself well for some of these challenges. And sometimes whilst you're at work, you may want to have a little time with getting to know what's going on, what is happening at home and all that. You find appropriate time to do that, but not when you are occupied. You need to do something for a patient and you are busy with phone. Hey, the next thing will be a complaint. The last thing I will give out in this video is, as an international nurse, protecting your PIN should be your topmost priority. And one way you can protect your PIN is joining a legal nursing association. Don't joke with that. Be a member, not just a member, be a paid up member. Register with an association and pay your dues. Why do you have to join a nursing association when you come and be an international nurse? You may never know. Some situations may hold back your PIN that you may need legal intervention. And if you are not part of any legal nursing association, how do you pull through? It will be very difficult for you to go through this. But if you are a paid up member, if you have registered with any legal nursing association, your association can take up legal actions on your behalf, and it's a very good way to protect your nursing PIN. So these legal nursing associations are there wherever you find yourself. Just identify them. If you're a psychiatric nurse, join the Psychiatric Nurses Association. Midwives, join yours. Better still, you can join the general one, which is the International Nurses and Midwives. You can join depending on your choice, but what the most important thing is, don't be practicing as an international nurse without you not being a registered member of any legal nursing association. So guys, this is what I have for you in today's video. If you find this video useful, please give me thumbs up in the comment section and give me feedback in the comment section as well. Let me know what you have learned in this video that is going to prepare you in your journey of becoming an international nurse. What have you learned so far in this video? Let me hear from you in the comment section. This is your girl, Nurse Abena, a registered psychiatric nurse in the Republic of Ireland. But hey, just as I always say, I am a proud Kenyan. These and many more information that you will get about overseas nursing, its migration, the job, lifestyle, and everything about overseas nursing. This channel got you covered, and that's why you need to keep sharing with others to join the family. Subscribe, like, and comment. See you another time in my next video. Until then, it's bye bye for now.